we really talked about different models for integrating cancer care in a bunch of different settings. So in my part of the session, or my contribution, we talked about some of the output from the Institute for the Future of Oncology symposium that we had in DC in July of 2017. And talking again, a lot of that was about the next gen multidisciplinary care team, and how you need to bring more people to the table to meet the needs of our cancer patients. We had one of our speakers was from Sanford Health System, which is a large multi-hospital system. I think they're in Montana, South Dakota, and they have managed to create care teams that integrate cancer care across their systems, creating multidisciplinary teams at their various hospitals. And for them, one of the key things was getting champions, getting physicians or other folks that were really passionate about that. Because if you get one person in your program that really is passionate about creating those multidisciplinary integrated care teams, that's a real key indicator or a key ingredient for success. And then the other panelist came from a small hospital on the Outer Banks, North Carolina. And their integrated approach really centered around radiation oncology, but getting additional input from other providers so that they could make sure they were providing the right care plan for their patients and not having to change care plans in midstream. And so that was about collaboration and about getting multiple different stakeholders, getting their physicians all engaged to collaborate with one another and review each other's care plans in a way that they could get that. So multiple different ways of doing it. Again, I think the first thing is the will to do it, realizing it's an imperative. The second is getting a champion or champions in your health system or in your program or your practice. And then the third is getting your providers engaged.